Hello, I'm Tony DeMaria, Editor-in-Chief of the Journal of the American College of Cardiology, and I'm pleased to be with you here to do another issue of the Genuine article. And today what I'd like to talk about is the fact that there are some very commonly utilized substances that can have significant cardiovascular effects, and we don't often associate these substances with those potential effects. We have at the moment in press 2 articles that deal with such substances. Now, the first one is omeprazole, the protein pump inhibitor that's frequently used for gastrointestinal problems, particularly for esophageal reflux. The use of these PPIs, such as omeprazole, have been very common, and in fact, they're often used in conjunction with antiplatelet agents in an attempt to protect patients from gastrointestinal bleeding. Well, an article that we have in press in JACC tested the concept that omeprazole in particular and PPIs in general may in fact have the potential to inhibit or blunt the effects of clopidogrel. Now, the reason for this, of course, relates to the fact that clopidogrel, in fact, is a prodrug that has to be converted to its active component in the liver. And so it's susceptible to influence by agents that can affect the cytochrome P450 system. Omeprazole and the PPIs are just such agents. Now, in this study, which was done by Dr. Martine Gillard and colleagues from the University of Brest in France, what they did was they used a very specific method of assessing clopidogrel activity called the VASP analysis, the vasodilator-stimulated phosphoprotein phosphorylation method. And without going into the details of that method, it is a particularly sensitive and accurate way of looking at the efficacy of clopidogrel in producing its antiplatelet effect. And so what these investigators did was to take about 120 patients, 60 in each group, give 60 placebo, give 60 omeprazole for 7 days, 30 milligrams of omeprazole, and determine then the effect of the omeprazole on the ability of clopidogrel to affect antiplatelet actions as measured by this VASP analysis. And the bottom line, the very interesting finding, was in fact that the omeprazole had a significant effect in blunting the antiplatelet efficacy of clopidogrel. In fact, in the group that was given omeprazole, the odds ratio of being a relative non-responder to clopidogrel was about 4.3 to 1. So that, again, a commonly utilized substance, omeprazole and its congeners, the PPIs, and the potential effect on the antiplatelet efficacy of clopidogrel, and this clearly could have significant findings or significant results in our patients who are undergoing PCI and receiving clopidogrel. Another commonly used substance is alcohol, ethanol. And in fact, one of the questions that was asked in a recent article that's about to be published in JACC was whether or not alcohol could have an effect upon ischemic preconditioning. Now, ischemic preconditioning is a very valuable protective mechanism whereby short bursts of ischemia can protect against more prolonged episodes. And so what these investigators did was to study patients undergoing PCI, wherein preconditioning was tested by looking at the electrocardiographic response to 2 subsequent balloon inflations. And they gave a rather large amount of alcohol. There's no question, about 150 cc's of alcohol to half the patients, no alcohol to the other half of the patients. And what they found was that the ST segment response, in response to balloon inflation, was substantially diminished, showing preconditioning in the patients in the placebo group, but in fact no such effect, no such preconditioning was observed in the patients who exhibited the alcohol. Now, levels of alcohol in this range clearly would be achieved in binge drinking, and the implication here would be that binge drinkers in fact may lose their preconditioning and may be at a greater risk of an acute coronary event. So these two articles clearly demonstrate, I think, some very important aspects about agents that are commonly utilized by our patients, whether they're proton pump inhibitors or alcohol. These commonly employed agents can have some very detrimental effects, and it's very useful for us as cardiologists to be aware of this. Again, for the Genuine article, thanks very much for tuning in.